during my medical school training, I had good exposure to urology, and I was attracted to it was, I suppose, the 50-50 mix of both medicine and surgery. With surgery, you can take a really active approach to treating disease, but also trying to solve problems in a medical manner within urology. It was a really nice mix. I think the other attractive factor for urology is that we deal with multiple organs along the urinary tract, so no operating list is the same in that setting. So the variety. Another attracting factor to urology, for sure, is my colleagues within urology. We tend to get on. We do get on very well, and we have a good drive for innovation. For example, the use of robotic surgery was kind of driven a lot by my urology colleagues. Okay. Well, I enjoy every day of my job, every aspect. So it's from trying to organize a list, from an operating list for myself and also for my trainees, so making it as productive as possible. I like the fact that I can deal with a range of conditions within my subspeciality. I like being able to work with colleagues, so for complicated cases, discussing it and coming up with a very bespoke treatment plan for patients. I do very much like the patient contact and really understanding the patient's beliefs and their concerns, and trying to address all aspects worrying them and communicating as best I can. Okay, I think patients value someone who listens carefully and intently and comes up with a personalized treatment plan. And I think patients value also a clear communicator. So if there's a condition, they have to be able to have the condition explained in ways that they can fully understand. And I try to use different approaches. Repetition is one thing, and drawing a diagram, and also allowing the patients to read up on verified resources. What I value from patients is a good working relationship. So if I provide some advice or I make some recommendations and we agree to follow that, I think if I get that back from the patient, for me, I find that satisfying, because we can work together to get the best outcomes for them. Okay, urology is such a broad speciality, and now it's broadened up so much that everyone has their subspeciality. So, for example, my subspeciality would be for kidney stone disease, so we call that endourology, and also prostate treatments. And that speciality for benign prostate surgery has really expanded over the last 10 years, where it seems like every 2 years that there's a new treatment and device which patients have read about and would like to have. And if you look back 10 years ago, there'd probably only be a handful, less than two or three treatments. So I think the challenges are really to find the specific treatments which are best for the patients coming to us. Patients, rightly so, are well read, and they have specific expectations when they come, and to keeping up with their expectations and to provide, the best service that I can provide. Sometimes that can be a challenge, keeping up to date with everything and be able to offer exactly what the patient wants. I suppose by working with groups and other urologists with other subspecialty interests, I feel that we can come to a kind of complete solution for the patients. It shouldn't be just only what I can offer. It should be suitable for the patient. If I think a patient's suitable for another treatment which I don't offer, then I think that's the right thing to discuss and refer on to another colleague.